October is Dysautonomia Awareness Month, so I thought I would just share my experiences with some of the conditions and some information about that, and then just like my symptoms and how I'm getting treated. Dysautonomia, like, typically is seen in people over, I think, like 50 to 70. And things like Parkinson can cause it, but it can also be caused by like a head trauma. So mine was started, it could also have been genetic, but I had gotten a concussion in a soccer match, and this essentially just started all of my symptoms. This is when everything sort of came up. My heart rate got very, very fast. Like, my resting heart rate used to be super low, and it got very elevated. And then a few months after my concussion, I started passing out. And at one point, it was about 3 times a day. A lot of the times, like, I wouldn't fully pass out, although I could. It was mainly just I was conscious and able to think a little bit, but I wasn't able to have control over my body, and like I couldn't hold my head up, so I would just kind of like sink out of my chair, and my hands and legs would sort of feel like floaty, I called it, which I think is just lack of oxygen, so they just didn't have blood in them. But for like many, many years, doctors pretty much just wrote this off as anxiety, which I do have anxiety, but it's not why I was having those symptoms, and I was not in a situation where I would feel anxious. And so my symptoms eventually started to get a little bit better, but then after graduating high school, I got in a car accident on the highway, and this sort of started all of the issues all up again, and it got really bad, where I was passing out again and fully, and then my resting heart rate was about 120 beats per minute, and I would just constantly have chest pains and heart palpitations, and I was put on like some different benzos, and that did not help anything. I also had things such as tiredness, insomnia. If I stood up, my heart rate went crazy high, and like chronic migraines. At one point, I had a migraine for 2 months straight. Although what makes me think that it is genetic, and was just sort of heightened by an injury, is that my mom would also pass out quite frequently as a kid, and has a lot of the same symptoms as me, and we both have issues controlling our temperature. So like if I get hot, I get very, very dizzy, but I also sweat like in an abnormally large amount. And my mom also had those same injuries. I mean, not injuries, those same symptoms, as well as some other people in my family. It can also impact your digestion, which I do have issues with, and cause like the symptoms that I've had, along with some other ones. And it's essentially just like a dysfunction of your autonomic nervous system. So everything that your body is like supposed to do without thinking, it's not doing that properly. So like temperature regulating, heartbeat, blood pressure, gastrointestinal control, sleep, all sorts of things like that. So it's very hard to diagnose. I mean, it's getting easier now, but a lot of the times doctors will sort of just write it off as anxiety, especially because it's, I think, like 80% of people who have one of the conditions, postural orthostatic tachycardia syndrome, are women. And a lot of the times, especially when women have conditions, it's just pushed off as anxiety. And so I ended up having a Holter monitor test because I do have Ehlers-Danlos syndrome, and they wanted to test if I had the vascular type. And they didn't see anything that showed vascular type. But I don't think the cardiologist was necessarily equipped to be looking for dysautonomia, because they said everything was fine. And then I recently got into the autonomic clinic at Vanderbilt, and They looked at my tilt table test as well as my Holter monitor, and just from the Holter monitor alone, they could conclude that I have inappropriate sinus tachycardia. This is Ollie, by the way. Yeah, so they said inappropriate sinus tachycardia, and they said that it looks like from my tilt table test, so my heart rate was pretty elevated. It went up like, I think it was like 140, 150 beats per minute when they stood me up. And they also said that it looked like I had vasovagal syncope because like POTS wouldn't typically cause you to pass out fully. So what they saw was when I was tilted up, my heart rate went up like super high, and then it hit a max, and then all of a sudden my heart rate and my blood pressure just plummeted. And then over time it did end up picking back up. And when I was like lowered after the test was done, they did see my heart rate going back down. So those are sort of the things that you would need to do for diagnoses. There's also something called a makeshift tilt table test where you can just like lay down for 3 minutes and take your heart rate and then your blood pressure, and then do that while you stand up. And then just look at the difference. And I think usually if your heart rate goes over 130 beats per minute with standing up, or like a 30 beat increase, that would be considered positive for POTS. And then they would just do a tilt table test to confirm. So that's what I ended up doing. And I'm now getting treated at the autonomic clinic, and I've started on verapamil, which is one of the common medications for dysautonomia. It's definitely started to help. I used to like have issues singing because I couldn't catch my breath, but I've noticed that I haven't had that issue as much now that I'm on that medication. Also, just wanted to mention, one of my other symptoms was like, I would have a lot of issues if I went to the bathroom. Sometimes I would pass out just like on the toilet. And that's just like another common symptom. But you can see like neurologists to treat this. You can see cardiologists. The only thing is, like at Vanderbilt in Nashville, the Vanderbilt cardiologists refused to take any patients suspected of having POTS or any other form of dysautonomia. So even though the autonomic clinic had a wait list of 2 years, I wasn't able to be treated the entire time I was in Nashville until I waited that 2 years and could get in to see the autonomic clinic. It's just very unfortunate because everywhere else in the world, cardiologists can and do treat those symptoms and those conditions. And I'm not exactly sure why they do that. I guess more like liability because they might not be as well informed. But I think in that case, a treatment is better than no treatment, especially since cardiologists are pretty educated about it. And there's still just like not a lot known about dysautonomia. There's only 3 autonomic clinics in the US, and 70 million people have dysautonomia, and it can come from COVID. And unfortunately, like the majority of the people with at least POTS are women. I think it's like 80%. So a lot of it is just underfunded. So we really need to increase the awareness so that more females that are passing out aren't just diagnosed as having anxiety, and we can get more funding to study it more and look into more treatments, because there's like a couple of medications you can take, but the majority of the other stuff that you can do is just like physical therapy, trying to train your heart to be able to sort of work when you exercise without getting super elevated. And then also things like salt and electrolytes and water, and making sure you get lots of sleep can also sort of help those conditions. And also compression shocks, because you get this blood pooling in your legs from issues with circulation. Hope this helped. I also just wanted to point out that I have Ehlers-Danlos syndrome, and this is often a condition that comes along with POTS or dysautonomia.